the VCA Voice Podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm happy to welcome Dr. Adi Oz and Dr. Negeen Najafi. Drs. Oz and Najafi are completing a small animal rotating internship at VCA Alameda East Animal Hospital in Denver, Colorado. Welcome, Adi and Negeen. I'm really happy that you're here today.
Hi, happy to be here.
Thanks so much for having us.
I know you're going to have a lot of great information to share with our listeners, so why don't we jump right in? And for our first question, I'd actually like to hear from both of you, and I'll have Negeen go first with this, but tell me a little bit about your journey in veterinary medicine and where you went to school.
Yeah, so my journey in veterinary medicine actually started at a very young age, as most people's do.
Mm-hmm.
Mine started volunteering in different animal shelters with my mom, and I would always watch YouTube videos of different veterinarians online and just get inspired. But throughout high school and undergrad, I volunteered at mostly small animal clinics, just as a vet assistant, helping out here and there, doing what I could, cleaning kennels. And it wasn't really until undergrad that I got most of my large animal experience volunteering at a goat farm. I also did some
They're small,
research.
large animals.
Yes, I fell in love with them. I also did some research on some larger ruminants, cows, and fell in love with them. So going from small animal only to starting to incorporate aspects of large animal medicine, I started to become more fascinated in being a large animal vet. So I applied to UC Davis School of Veterinary Medicine and got in. So that's ultimately where I did my training. And throughout my first and second year of vet school, I was totally focused on the livestock track. I worked at my school's livestock barn. I just fell in love with it. I fell in love with kind of the travel aspect that they have.
Mm-hmm.
But then it wasn't until my third year I did some outreach work with emergency vets, and I fell in love with the emergency aspect of vet med. So I kind of took a 180, and then I got a job at a ER up in Sacramento, not too far from my school, and working there, it kind of changed my perspective and I fell in love with emergency. So again, I just switched from livestock to emergency. And then my fourth year of vet school is kind of when you get all of the different experiences. And I rotated through ER twice and it kind of confirmed that's what I wanted to do. And from there, I decided to do a rotating internship just to get more confident in my emergency skills and all the different aspects of vet med. So my journey is kind of interesting because I went from small to large, back to small, and ultimately chose small animal ER.
So Adi, how about you?
Yeah, so my vet journey probably started when I was really young. And I think I've always wanted to be a veterinarian. I just always had a love for animals, and my favorite classes in like elementary and high school and everything were science classes. So it kind of just made sense. In undergrad, I studied animal sciences and I worked at a small animal practice back at my hometown for the summers that also had an ER as well, and got some good experience there. And then I went to vet school at Oregon State University.
Wonderful.
And I've pretty much been always small animal tracked. And then in vet school is when I fell in love with neurology and knew kind of that's what I wanted to do.
So that brings us to internship, because many veterinarians graduate and they go out and join the workforce. And you both have decided to do a small animal rotating internship, which I'm very proud of you for. I wanted to learn more about that process and your why behind internship.
Yeah, so first year I took the neuroscience class and figured out, I really like this subject and neurology seems like a really interesting specialty to me. How do I get there? And pretty much found out that I would need to do a rotating internship before pursuing a residency. And I guess that's probably the point where I figured that's what I need to do in order to get to where I want to be. But now going through the internship process, I feel like either way, whether I would have wanted to specialize or not, that an internship is super beneficial. And probably would have done it either way.
That's a great point, and I agree with you that they are beneficial. And Negeen, I'll ask you a little bit about the process of finding internships. There's a whole bunch of them out there. What is it like to go through that process of finding an internship, going through the match process, and how many programs did you apply to, and what were you specifically looking for in a program?
So for me, location was a huge thing. I wanted to be in a place where I knew I could go to the mountains on days off. And so for me, I prioritized location when looking for programs. And also I prioritized private practice. Obviously, we did vet school in an academic setting, and I knew private practice gave kind of a more intimate learning experience. You work right alongside clinicians. Most private practices don't have residents there. Some do, but I knew I would kind of get the most out of my internship working right alongside clinicians and being kind of on the ER track rather than residency. Private practice was the way to go for me. So I focused on location and private practice and ultimately narrowed it down to 10 programs that fit both of those criteria. And then from there, I reached out to current interns that were at those practices, set up either phone calls or FaceTimes just to kind of pick their brain about the practices. And then from there, I went ahead and planned visits. So I visited my top 3 practices just to get the feel of what are the interns doing on a day-to-day basis? Are these specialists that I can see myself working alongside? How does their ER work? All of those things were really important to me. And ultimately, I ended up doing an externship where I'm at for 2 weeks. And I fell in love with kind of every aspect of the hospital, not only the people there, but also the medicine that they practice. And it felt like I was meant to be there. And I'm really glad that I ended up where I did.
Some students go the route of doing an ER mentorship program, which is a program that gets you right into doing ER. And you decided to do a rotating internship. In your opinion, what is the benefit of doing a rotating internship and getting to work alongside specialists for that year?
So for me, I think coming out of vet school, I really wanted the opportunity to still learn from specialists. I think ER, you kind of need to know a little bit about everything. So not only just stabilizing emergencies, but you need to know neurology, you need to know internal medicine, you need to interpret x-rays and ultrasounds. So I think having that extra year after vet school, working alongside all those specialties and learning more from the cases that they see really helps on the ER floor, because sometimes I'll be seeing a patient and they'll have a neurologic condition that I saw last week on neuro, and now I know what to do. And also just having the specialist there as an intern, being able to consult with them, getting their opinion, I think it just adds another level to your medicine. And for me, I want to be a very well-rounded ER doctor, knowing all the different aspects of that med. I know it'll take me a while to get there and be confident, but I think an internship is the first step in that process. And I really would not regret doing a rotating internship just to gain that extra experience in all the different specialties, because I can definitely see the benefits when I'm on ER.
So I want to hear this question from both of you, and Adi, I'll start with you. As new veterinarians graduating, you go through graduation, everything's wonderful, and you're starting your first job. What were you most nervous about?
For me personally, I feel like I was most nervous about the overnight rotations and like primary case management, because I feel like the switch from being a vet student to being a clinician is like a really drastic change. That even an internship, it's a big change. Even with all the support and mentorship, I felt like I definitely had some struggle with my like personal confidence and being the primary clinician. And then overnights, I feel like bring a whole other ball game, because you're up at like 3 a.m. working this really long shift. And luckily at the hospital that we're at, we get a staff ER doctor on with us the whole time, which has been super helpful for that transition as well. So we can relay what our thoughts are on certain cases and how we want to go about managing those. So that's been helpful, but it's definitely been a challenge building up the confidence in being a primary clinician, because it's very different and being a fourth year vet student on clinics, when you're just, mostly taking like the history and then you go into the exam room with the attending or the rotating intern at the school or the resident, and they are doing most of the client communication. So it's that change. I felt that was what I was most nervous for. But I feel like an internship definitely helps kind of bridge that gap to make you feel more confident in yourself.
Yep, that's a hard step. And Negeen, what were you most nervous about?
I think just like everyone else, I struggled with imposter syndrome starting internship, working alongside all these fabulous specialists. I feel like I kept thinking to myself, wow, do I really belong here? Will I ever be good as these ER doctors and specialists that I'm working with? That's definitely been a work in progress, but also not only that, just kind of opening my mind to learning every day. And it kind of was overwhelming at first because every single day you learn something that you probably didn't learn in vet school, and it can be overwhelming. And I feel like just accepting that you're not going to know everything and keeping an open mind was really important for me to realize early on in internship. I feel like to this day, I still learn something every day that I didn't learn in vet school or didn't even know existed, whether that be in rounds or a case that we see. So I think that was a little overwhelming to grasp at first, but now it's just amazing that there's still so much more to learn.
Dee, tell me a little bit about the internship program at VCA Alameda East. How many interns are in your class, and what does your work schedule look like?
Yeah, so we currently have 9 of us in our intern class. We recently had 3 that ended in February because they started in February the previous year. So when I started, there was 12 of us total. So we had a pretty big intern class, which has been really nice. I feel like we've all gotten along really well, really supported each other, which I think is a really important part of internship. We do like a lot of activities together, try and do like an activity kind of once a week together for like team bonding. So that has been a really fun part about internship. So that support that we get from our internship class. And then in terms of our work schedule, it really depends on the rotation and, the day and the caseload that you have. But I feel like on average, it's like 50 to 60 hours a week. And we have basically about 2 days off per week. It just depends what rotation we're on, kind of where those 2 days fall. So sometimes we'll go, like 8 days working in a row, but then we'll have like a 4-day weekend. Okay. So it really kind of depends on the rotation itself. But I feel like it's a very doable work schedule. I mean, it is an internship. You are, supposed to work hard. There's going to be long hours, but I feel like we do get adequate time off.
Negeen, what does supervision look like at your hospital?
So interns are never alone, which actually was one of the biggest draws for me, especially on overnights. You are not left alone. You always have a staff doctor with you to bounce your cases off of, bounce your ideas off of. And same goes for the daytime. You're always working alongside a specialist if you're on a specialty service, and you're always working alongside a group of ER doctors if you're on daytime ER. So I feel very supported each and every day. I never feel like I have to make a decision on my own. But also on the flip side, this internship also gives you the autonomy to make all the decisions on your own if you wish to do so. Primarily on ER, specialty service is a little different because you're working right alongside the specialist. So obviously you have to run everything by them. But on daytime ER and on overnights, after your first month of ER, you're allowed to take as many cases on your own as you wish and kind of do as much as you're comfortable with. So if you're very comfortable managing a vomiting diarrhea case that comes in on your own, then you don't need to run your thoughts by a veterinarian. But if you have a question about a protocol or one of your ICU patients is unstable, then there's always someone there to help you if you have any doubts, if you have any questions. I really kind of like that dichotomy of you have someone there if you need it, but if you feel confident on your own or you want to kind of push yourself, you also are able to do that. So that was kind of really important to me that I'm not alone on overnights, but I also have the ability to push myself and see what I can do and then ask for help if needed.
And do you feel like you've been able to grow over the year in your confidence on ER?
Definitely. I think the first month of overnights, just getting used to the schedule was hard enough. But my second round of overnights was kind of in the middle of the year, and I could definitely see
Mhm.
improvement in my confidence and my ability to take cases on my own and not have to run them by my staff doctor. And then same goes for the ICU inpatients. I felt more comfortable managing their cases, but also there was cases that I was just kind of overwhelmed with and needed help, and my staff doctor was always there for me. But definitely from my first month of overnights to my second, I could see the improvement that I had made, which is really cool to see.
So, Adi, do you talk with any classmates that are doing an internship about their experience?
I have a few classmates. I would say probably like 7 people total in my
Uh-huh.
class did an internship, which is probably a little bit different from Negeen, who I feel like most of her class did an internship.
True. There is a lot of variation in different
Yeah.
schools as to how many students do internship. That's true.
I recently talked to one of them that's in a different private practice, and she seems to be enjoying it. I didn't get like a full detail about everything, but I feel like pretty much everyone that I've talked to that's done an internship has never regretted doing an internship. And I feel like it basically goes along the line of, it was a really, really hard year and I don't ever want to do it again, but I do not regret it at all. And I'm so glad that I did it. And I feel the same way.
For each of you, and I'll start with Negeen, can you share one great thing and one challenge with being a rotating veterinary intern?
Yeah, I could share so many great things about being an intern. I think, especially at Alameda, I think the people are amazing. All of our specialists are so great. And I've always felt comfortable working alongside of them. I think going into internship, I thought it would be very intimidating working on specialty service, but it really feels like you're working as a team and that you're contributing to the team, which is a great feeling. And I just learn so much every single day. And I don't get treated like an intern. I don't get treated kind of like bottom of the totem pole that you would expect. You really feel like you're part of the veterinary team that's providing care for the patient. So I think that's a really great thing about being an intern. You're part of that entire process, start to finish. I think one challenge for me was going from kind of an academic place where you had your resident or your faculty, they're doing all the client communication. They're going over all the estimates with the client.
Mm-hmm.
To now, you're an intern on ER, you're doing all of that yourself. So for the first time, you're having to have those difficult financial conversations, difficult end of life conversations. So just learning how to do that, learning how to essentially talk to clients, I think was really challenging at first. I think an internship gives you that experience probably 100 times more than just going out into practice because it's such high volume every day. So I'm really grateful for that. But it was challenging at first having those difficult conversations because I feel like in vet school, you may have, a simulation lab here and there, but once you're there in the real thing, it's quite different. So I think that was challenging.
Yeah. So, Adi, what about you? One great thing and one challenge.
Yeah, I would have to agree with Negeen that we just get such great mentorship at this hospital. I feel that we can pretty much ask anyone a question and they will help us with our case, obviously trying to get us to learn and asking us questions as well. But I feel that we're really supported and it's a really positive learning environment. I also feel like being able to rotate through the different services in a busy multi-specialty hospital has been incredibly beneficial to my learning and making me a well-rounded doctor. And then in terms of a challenge with being an intern, for me, definitely building my confidence as a primary clinician. But I feel like I've seen so much growth in that since, my first round of overnights and my first week of day ER were pretty rough. And I really struggled in being that primary clinician and, figuring out how to go, to have those conversations and how to kind of be more efficient with my time management, with all the things going on with different cases. And then to see where I'm at now, I feel like I've grown so much and became more confident. And I feel like I still have a lot of room to grow, which I'm, excited to do as well.
Adi, I understand you're on your way to becoming a veterinary neurologist. Congratulations. When did you decide on neurology and what intrigues you about that specialty?
Yeah, thank you. So I pretty much knew since first year of vet school when I took the neuroscience class, I just became fascinated with the complexities of the nervous system. And then I participated in Alzheimer's research with my neuroscience professor during that summer. I just really love that neurology is like a combination of medicine, surgery, imaging. But then the neurologic exam is really logical. And for the most part, I mean, obviously it's neuro. But for the most part, it tells you exactly where your problem is. And I really like how like methodical neurology is. And then I also just really can't wait to help animals walk again as well, because we get to help do that, which is really fun.
Negeen, you love ER, and that is where you decided to go. So what's next for you?
I am very grateful because I am staying on at Alameda as a staff ER doctor next year.
Yay!
Yeah. So it'll be great
Excellent.
to already kind of have those connections with everyone. And I love everyone at this hospital. It's been a great year. So I'm excited to stay on as a staff ER doctor.
Well, we're very lucky to have you, and congratulations. That's wonderful news.
Thank you.
And I'm glad that your experience has been so good that you want to stay on and be there.
Yeah.
Negeen, I know that both of you have seen lots of cases. Do you have a favorite?
I do. And it was actually one of my recent cases not too long ago. I started off on the neuro service and it was over the weekend. We got a case transferred to us from another emergency clinic for a neurology workup for suspected back pain. And the dog came in. We thought we could localize back pain, but it turned out to actually be referred abdominal pain. So we did a very large workup throughout the day on this dog. We ended up actually putting it through the MRI. We did a CSF tap, didn't really find much. And then we took the dog to abdominal ultrasound, and he turned out to have a septic abdomen.
Wow.
So it kind of went from a whole 180, a very sinister physical exam. We couldn't really localize, did a bunch of diagnostic testing, and then we found a very, very, very small pocket of free fluid in ultrasound that even the radiologist was a little hesitant to poke, but ended up rocking it, got us a sample, confirmed our diagnosis of a septic abdomen, and we took him to surgery. So it was a very long day, started at like 7:30, didn't leave until about 1:30 at night. But it was so cool being able to do that whole case follow through as the intern, switching from neuro to surgery and working with the different specialists on that case. And ultimately in surgery, we were able to get a biopsy of the dog's problem and get the owners an answer. So I know the owners went through a day that day, but I was able to communicate with them as well throughout the whole day. And it was a very emotional day kind of for everyone involved. The owners actually came back last week for a recheck, and I was able to see the dog as well as the owners. So it was a very cool case, and it kind of teaches you that medicine isn't always straightforward. You can get a patient being referred for something completely different than what its actual problem is, and it's your job to get to the bottom of it. And so that was just a really fascinating case to me, not straightforward whatsoever, but I'm really glad we were able to get the dog feeling better and get some answers for the owner as well.
Well, that's very cool. Adi, what about you? Favorite patient?
Probably the coolest case that I've seen thus far would have to be this puppy that presented to the neurology service, which I wasn't on at the time, but I got to scrub into a procedure called a ventriculoperitoneal shunt, which I know is a mouthful of a word or words, but it's basically a surgical treatment for congenital hydrocephalus, which is that buildup of fluid in the ventricles, which are in the brain. And this procedure basically works to shunt the fluid from the ventricles or those fluid-filled cavities in the brain to the peritoneum or the peritoneal cavity, which is the abdominal cavity. And the way you do that is you drill little holes in the skull and put in a catheter into the brain, into the ventricle, and then you tunnel the connection from the shunt itself or the catheter itself under the skin and then make a hole in underneath the skin into the abdomen. And then the fluid will basically collect in the abdomen, and then the abdomen will dissolve that fluid over time. And it helps basically decrease the increased pressure within the brain. And the puppy had presented super neurologic, wasn't really able to walk. And I was actually on neuro when they did the first recheck, and she was walking and looked really great. And so that was a really fascinating case to me. And I was so excited to be a part of it.
Dee, were there any misconceptions about internships or things that you heard about internships before you got started that have turned out to not be true based on your experience?
I feel that everyone says that you just don't have any time off. And I'm sure that kind of depends on the internship program itself. But I feel for me, I have had a really adequate amount of time off. And I've been able to do a lot of fun things like exploring the Denver area because I'm not originally from here. I've gotten to go on really cool hikes. Me and Negeen actually hiked a 14er together. We've been to some concerts at Red Rocks together. We're able to hang out with our intern mates, outside of work, and then also, spend time, at home with our pets and just take care of things that need to be done, like grocery shopping and cleaning our apartments or our houses. So I feel that there is, time for that. Obviously, some weeks are longer than others, but I feel like that's a pretty big misconception about internships. I think with the right program that you will be able to have a really good work-life balance.
Yeah, I definitely have to agree with a D. I thought I would have no life, no time to hang out with people outside of work. But again, not the case whatsoever. We've had plenty of time outside of work to do things that help our mental health and things like that. And like I said earlier, I think I had the misconception of the intern is kind of the bottom of the totem pole. They don't get to do the fun thing. They're just there to learn and work really hard. But that wasn't the case at all, especially at our hospital. I feel like we're such a part of the team. We're an integral part of the process for the patient. And we're the primary clinician on ER, which I don't know what I was expecting going into internship, but I don't think I thought I would have that much case responsibility. And it's really cool that we do straight out of vet school. I think it's a really important part of learning and pushing yourself. So that was kind of a misconception I had, was that I'm only here to learn from the specialists and things like that. But you're part of the team no matter what service you're on.
We're about at the end of our time together. So, Negeen, I'll start with you. What advice would you give for current vet students who are considering doing internship or getting ready to go out into the workforce?
I would say definitely do an internship, no matter what you're heading out to do. I think you just learn so much that vet school doesn't teach you, not only about medicine, but also about client communication. I definitely would not regret my decision at all of doing an internship. I would do it 10 times over. And I think throughout your year of internship, if you do choose to do one, work hard. I feel like you get out what you put into an internship. So just take the year, take advantage of the year to learn as much as you can. It's really a great experience.
Excellent. And Adi, how about you?
Definitely do it. Do the internship. Whether you're considering it, just do it. It is so rewarding and so necessary, I feel like, to make you, a really well-rounded veterinarian, whatever you decide to pursue. And I know this sounds really cheesy, but trust the process. It can be really frustrating at times, feeling that imposter syndrome like Negeen talked about earlier, and not seeing the growth immediately, and going from, doing really well in vet school to now you're starting a very new journey. Even though you studied for it for 4 years, it is completely different than being in an academic setting, in a school setting in general, just to be a clinician and thinking like that. And that skill will come over time, and you just have to trust that it's going to happen, but also put in the hard work.
And what about if someone graduated, they decided to go into practice, and then they're considering going back for an internship a year or two later? Is it too late?
Definitely not. We actually have one of our intern mates did a year of ER after vet school, and then came back and is doing an internship right now. So it's never too late to do an internship, to just learn more. It's never too late for that.
Excellent. Well, it's been such a delight talking with both of you. Thank you so much for your time. I know it's really hard to find time when you're an intern, and especially to find both of you together was quite difficult. And I appreciate you being willing to have a chat. And congratulations, your futures are bright.
Thank you.
Thanks so much.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Twitter, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.